Hi all, this is Dr. Reshmi. In this video, we are going to see about intrauterine insemination. Definition: direct transfer of processed semen into the uterine cavity at the time of ovulation is called as intrauterine insemination. What are the advantages of IUI? It is non-invasive procedure, inexpensive, easy to perform, training is easy, and also the risks are minimal. Now we'll see the indications in male, female as well as combined. So in case of male, retrograde ejaculation, hypospadias, impotence, infrequent intercourse during fertile period, oligospermia, asthenozoospermia and teratospermia. In case of female, cervical mucus hostility, poor cervical mucus, endometriosis and as well as vaginismus. Combined factors include immunological, male as well as female anti-sperm antibodies, unexplained infertility while waiting for in vitro fertilization, women with patent tubes and IVF is not affordable. What are the contraindications of IUI? Cervical atresia, cervicitis, endometritis, bilateral tubal obstruction, amenorrhea and as well as severe oligospermia. Steps of intrauterine insemination. So, first is always selection and counseling of the partners. Ovarian stimulation, monitoring of follicular growth and endometrial development, timing of insemination, sperm separation and as well as intrauterine insemination. So selection. So always for the male partner we have to do semen analysis and mid-luteal progesterone for the female partner. HSG should definitely be done before proceeding with intrauterine insemination to know the patency of the tubes. Baseline ultrasound on day 2 for the female partner and also AMH, anti-Mullerian hormone, to know the ovarian reserve. Ovarian reserve is usually less in case of elderly patients. Counseling. We have to obtain the confidence of the couple. The cost and complications should be explained in detail to the couple. The success rate of intrauterine insemination is 15 to 20% per cycle. Ovarian stimulation. So, it is usually done to increase the number of oocyte available, to increase the steroid production, which may improve the chance of fertilization and embryo implantation. So the disadvantages of ovarian stimulation includes ovarian hyperstimulation syndrome, multiple pregnancy, the cost of drugs and monitoring. So coming to the monitoring of follicular growth and endometrial development. A baseline ultrasound is usually done for the female partner on day 2 of her cycle to check the antral follicle count and to exclude any ovarian cyst. So presence of ovarian cyst. In a case of ovarian cyst, we do not stimulate her ovaries in that particular cycle. Day 3 FSH and LH to the female partner. And from day 8 of stimulation, we have to do serial ultrasound monitoring to record the follicular growth and endometrial development. So methods for timing of ovulation. So here we have two methods. Urinary LH search. In this case, there are so many LH strips available in market and the patient can buy and use that. So if it is positive, then IUI can be done 36 hours after a positive urine test. Ultrasound folliculometry, HCG should be given when the leading follicle is 17 to 20 mm. And also the endometrial thickness should be at least 8 mm. Number of inseminations. So in a particular cycle, either one insemination can be performed or 2 inseminations can be performed. In case of one insemination, it can be done 34 to 38 hours after HCG or 24 to 36 hours after urinary LH surge is positive. So in case of two inseminations, it is usually done 24 and 28 hours after HCG or 12 and 34 hours after urinary LH surge is positive. Technique. So it is usually done in a case of full bladder in patients with anteverted uterus. The patient should be in lithotomy position. The cervix is exposed with cusco speculum and rinsed with saline. The catheter is firmly connected to the cone of 1 cc tuberculin syringe. The catheter tip is advanced to a depth of 6 to 6.5 centimeters and the sperm is injected. The patient should rest in supine or reverse Trendelenburg position for 10 minutes. Post-procedure care. So the patient may resume her normal activities after insemination. Abdominal discomfort or slight bleeding or spotting can be seen after the procedure. So urine pregnancy test should be done after 2 weeks of the procedure. Oral or vaginal progesterone supplements should be given to support the pregnancy. Complications of IUI are uterine contraction, intrauterine infection, multiple pregnancy, and as well as ovarian hyperstimulation syndrome. Factors affecting success rate or cause of infertility, age, duration of infertility, treatment of rank cycle, sperm parameters, and as well as uterine polyp. Thank you. Please like, share, and subscribe if you like this video.